This week on The Futurists, Daniel Kraft.
Many diseases are complex, but we'll see some proactive cures, kind of like the Minority Report. You'll cure the disease before you even know you have it.
Welcome back to The Futurists. I'm Rob Tercek with my co-host, Brett King. Hi, Brett.
Hey.
Are you back in Thailand now, or are you in the U.S.?
Yeah, I just got back from a week in Amsterdam, where we had an event there, and and then here for just over a week, and then got to head to Mexico City for another event.
Oh boy, very well, fun. Oh, perfect time of year to visit Mexico. So here on The Futurists, we love to talk to people who are not just thinking about the future, writing about the future, but actually doing something active to invent the future and make it happen. And this week we have somebody I'm thrilled to join us. We met ages ago, more than a decade ago, at Singularity University, where he's on the faculty.
Okay.
But let me just share you briefly.
Which version of Singularity was that?
That's the Ray Kurzweil and Peter Diamandis.
No. I've done work for Singularity on the finance side. Oh, it was one of the specialist streams.
No, this was back in the day when they just had Singularity University.
Cool.
And it's a great gathering, right? Because that's they always bring together like-minded people who are thinking about the future and overachievers. Now listen to this background. By way of introduction, you're going to love this. Right. Talk about overachievers. Our guest today got his undergraduate degree at Brown, then went to Stanford Medical School, did his residency at Harvard, went back to Stanford for a fellowship. He's given 4 TED Talks. He's the chair of the X Prize's Pandemic and Health Alliance Task Force. And he's as I mentioned, on the faculty of Singularity University, where he focuses on the future of medicine. And he's also the creator of his own event, which was previously known as Exponential Medicine, but now it's known as Next Med Health. And he gathers there about 70 faculty and attendees from more than 40 countries come together each year in San Diego to talk about the future of medicine and the future of health. Let's give a big warm welcome to my friend and super futurist, Daniel Kraft. Hi, Dan.
Hey there. Thanks for having me.
We're so psyched to have you here today. So, this is going to be a fun show because honestly, for most people, the pandemic was a period of time where they stayed away from the doctor's office and rightly so. So that means for a few years, we may have missed any of the new innovations that are happening in the healthcare field. And I wanted to hear your perspective on some of that, because I know you talk about this subject all the time.
Outside of messenger RNA vaccines, of course.
Oh, yeah, that's true. We all have that experience. Yeah.
Yeah. I mean, especially early in the pandemic, we did stay away from the traditional clinic. And that was to some folks' detriment. People didn't get screened for cancer or ignored heart attacks. And there was lots of downstream implications. But if we want to zoom back, big picture, COVID acted as a catalyst for many things in healthcare that were sort of stuck, whether it was telemedicine or new ways of doing virtual clinical trials or some elements of public health. It also opened our eyes to many of the disparities and challenges we have. We're still using fax machines to communicate public health data from many states. But big picture, it did accelerate some elements in what's often incremental healthcare to exponential. And I'm an optimist by training, and I think some of the things that converged and came to be from the pandemic and hopefully save more lives than the pandemic took in the long term.
That's a positive view on it. It's true. In a way, COVID was like boot camp. It was like forced exposure to some advances. And candidly, the healthcare industry moves slowly because it's heavily regulated and people's lives are at stake. So I guess that's warranted. But the telemedicine is a great example of something that we got shock treatment exposure to. It's like if you wanted to see a doctor, suddenly the best way to see him was on your phone. Something we'd been talking about for 10 years, but it was pretty hard to get people to move on that. And most people felt like, well, I'd rather go see the doctor. But suddenly going to the clinic, well, that's where sick people are. So nobody wanted to go to the clinic anymore. And it made more sense to turn to the phone. Has that persisted since then, or has it dropped off somewhat?
We certainly had this huge spike, particularly not just driven by the pandemic, but the incentives. All of a sudden, the payment models were unlocked from things like CMS and Medicare. The HIPAA regulations were loosened, so you could do a Zoom call and not be breaking the law and talking to a patient. So some important things were sort of shifted. In some cases, those have shifted back a bit. So we certainly don't have the same level. I think we're moving more into this new age of not just virtual care or physical, but hybrid, right? Many things you go to see the doctor or the clinic don't require you to be there physically, but there's still the important human touch. Certainly, you still need to have laboratories and sometimes physical exams done. But I think we're going to enter this hybrid age, and even before you talk to a clinician on a screen, you'll first talk to the chatbot that's going to increasingly be ChatGPT enabled, and it's going to know, Robert, your entire history and your microbiome and other omics information. So you're not saying the same questions, asking how old you are and where you have your belly pain. It'll put all that in context for you. So we're just at the beginning, I think, of this hybrid telemedicine or metaverse, or I'll call it mediverse age, where how we integrate with our clinicians, our care teams, our health chatbots is going to be dramatically different.
Before we get into the ChatGPT, there is significant advancements happening in the sensor tech as well that result in better data inputs. So we just saw that Apple's XPG, their experimental products group, has announced that they've had a breakthrough in terms of an imaging sensor that can detect non-invasively, can detect blood sugar levels, as an example. And we've seen already significant advances in the sensors for heart rate monitoring and things like that. But, one of the things that we comment on often, Katie and I, when we talk about this stuff, is that, you can get, you can walk into one hospital or one doctor and have some history there, and that doctor knows all of your history. But if you go to a new country or a new city and you walk into a new hospital, you seem to start from scratch. But we're also trying to solve that with sort of obviously DNA sequencing. You talk about gut genome and just better sharing of that sort of data. Now you can of course carry it around on your phone, emergency medical data and so forth. But what's the infrastructure piece of this that's providing that data platform or that ecosystem for better medical monitoring / analytics, diagnostics, et cetera?
Yeah, we're definitely entering this sort of exponential age. Just back to the wearable piece. Yeah, I'm wearing my Apple Watch. It's only been 12, 13 years since the Fitbit really first came out. And many of us are data geeks. We're quantified selfers. We can track our steps and our sleep, but it's been stuck on our app, most likely. It's starting to be able to shift from your smart wearable into your healthcare system, to your pharmacist, to your nutritionist, and be super useful. Quantified self to quantified health. The challenge is we're all generating potentially terabytes of data. Your doctor, if I'm your doctor, I don't want to look at all your data, your EKG, your blood sugar, your blood pressure, which is all coming to your wristwatch pretty soon. The trick is, how do you make that big data and synthesize that to actionable information that you as a human consumer patient can use proactively to be much more engaged in your own care, be the CEO of your own health. But back to the systems issue, where does that data reside? Who's responsible for parsing it to kind of give you that check engine light if you're about to blow a gasket and give you early warning? Right now, there's so many scattered healthcare systems, let alone the US, let around the world. There is no one architecture. But now that you can collect that on your smartphone and potentially own your own data and choose where to share it, I think we're going to see a lot of new solutions where you can start to build your own personal digital twin, is sort of the buzzword, where it'll be a combination of your digitome, your sociome, your metabolomics, et cetera, that can really give you personalized guidance for prevention, for early diagnostics, and for therapy. But there's still the huge challenges of the systems element, the siloed data, the cross-pollination doesn't happen because of well-meaning but old regulations like HIPAA. So we need to think at the systems level to connect the dots for what's already pretty magical technology today.
Wow, that's a sweeping view. I wonder if we're able to connect the dots as elegantly as you envision. It seems like it's a work in progress, and we're kind of like futzing our way and patching our way towards the future. We've been hearing about the progress in wearables for many years, like you pointed out, 13 years or so. Now, it is true, Apple's consolidated all of that technology into the watch, and they seem to be on a kind of a mission to gather all that wearable data and include all those sensors in the phone. How useful is that actually today to doctors?
Well, right now, it's not particularly useful. It's pretty hard to get your Fitbit or your Apple Watch data to your clinician, even if they know what to do with that data. I like to see where this is heading more as like predictalytics. Like, each of us today can use your standard smartwatch or wearable, not just to look at your spot data from the morning. I can look at my Oura Ring sleep score, but I can also look at my longitudinal resting heart rate, or how I recover from exercise, or my overall sleep patterns, or maybe an oxygen saturation, and soon continuous blood pressure, maybe even continuous blood sugar, which might be relevant for many folks. And then we can have what I like to call sort of like your individualized baseline. Robert, what is your resting heart rate's 52 when you sleep, and it starts rising to 65, and some other changes, maybe in your gait or other elements, can be picked up that can give you kind of that early warning that something is a little off, and can point you to be almost having a continuous physical exam. I mean, think about our current model. You once a year, if you're lucky, you go in for your standard physical exam. It's very intermittent data that's collected once and siloed. And that gives us a reactive mindset. We wait for the heart attack, the stroke, the late stage cancer.
Right.
If we start to connect the dots between the existing data, let alone the future, we can be much more proactive and personalized, and find problems early and cut them off at the bud.
But it seems like the Apple Watch is pretty close to that already. For instance, my Apple Watch does show me my sleep cycle, and it shows me averages. It'll compare my, I guess my sleep performance to previous days in the week. It shows me trends. So I guess some of what you're describing is gradually happening. What's interesting is it doesn't seem to compare my data to other people, even my anonymized data. I would be interested in that because, for instance, my Google thermostat does that. It tells me about other houses in my neighborhood, and it says, I'm in the average, or maybe I'm in the high or the low or something. And it gives me kind of an incentive to try to be efficient with my home heat, my home energy use. And I wonder if we could do something similar with personal wearables.
Yeah, I think making the data, and not just data, but actionable insights, and those insights useful to you as a clinician at the bedside or the website or in your context, is incredibly important. And sometimes it can be gamified, because you can be finding the Robert level of incentives, points, gaming, badges that match you. Yeah. And ideally we start to crowdsource that knowledge. I always love the example of Google Maps or Waze. I mean, 15 years ago, we're still driving with paper maps, and now we couldn't imagine getting around without Google Maps or Waze. That's crowdsourcing driving information. What if we had the Google Maps or Waze for health journeys that were very hyper relevant and local to you and your conditions and genetics and beyond, and gave you insights to your health journey? And we're starting to see that happen, right? There's the All of Us trial from the NIH, where people are sharing their data, their labs, their genomics. There's a platform out of Israel, actually founded by one of the founders of Waze, called StuffThatWorks.health, where now millions of folks are sharing what's happening for their psoriasis or their long COVID or their plantar fasciitis. And you can learn from the crowd about what might work really for you. So lots of opportunity to connect the dots. It's not about the data now. It's how we make that actionable and hyper personalized.
I can see this is going to be a great conversation. But before we rush off and tackle all the other topics that are clearly popping up, let's get to know you a little bit better. So, Daniel, are you still a practicing doctor in addition to being a futurist?
I'm still licensed and dangerous. I trained, as you mentioned, in both internal medicine and pediatrics, med-peds, and then I did pediatric hematology, oncology, and bone marrow transplantation. And for a while, I was doing clinical faculty at UCSF doing pediatric transplant, and then got a little too busy. I was also juggling being a flight surgeon in the Air National Guard, so spending weekend a month taking care of fighter pilots and getting to fly with them occasionally. But I'm still licensed. I've done a little telemedicine, take care of my friends and family, but I've got a few too many hats to sort of be in the clinic on a regular basis. Yeah.
How do you get from pediatric transplants to doing National Guard sort of combat healthcare or something like that?
I grew up with the sort of flying in space thing. I grew up in DC. I went to the Apollo 17 launch when I was a kid. I always wanted to be an astronaut. Almost got to be an astronaut. I got to the very, very final selection down at NASA and went through all the exams and tests. And my left eye was not quite 2150 enough. But that gave me this whole pathway. I was a pilot as well. And I thought, wow, I always want to be a fighter pilot, but didn't have 20/20 vision. And it turned out I could be a flight surgeon. I'm like, you're actually going to pay me to fly in fighter jets? Sign me up. So when I was a resident Mass General, I raised my right hand, joined the Massachusetts Air National Guard. It was an F-15 squadron on Cape Cod, and had an amazing experience flying with them, really seeing the inside of the military. I got to do deployments to Saudi Arabia. Two of my pilots were the guys over in New York City on 9/11. Later with an F-16 squadron in California. But that was sort of my whole flying in space passion, which I still have. And
it's still pretty cool, dude.
Yeah, and there's lots of lessons from aviation, let's say, for healthcare: checklists, crew resource management, how your jet engines now stream data down to the ground and make flying much safer. So I love the kind of overlap. And I even went way back to International Space University when I was a space geek in medical school. And just like in healthcare, you need to kind of connect the dots between different fields if we're going to really move things forward. And space is a kind of especially space medicine, is a great challenging area to help build the future.
Now, Rob, you're going to have to watch we don't go down the rabbit hole, Daniel.
I think this is going to be a rabbit hole kind of a show. I can already see that happening.
I will ask, what do you, as a GA pilot, what do you fly these days?
Well, it was really tough going from F-15s and F-16s. I got to fly in the backseat. They didn't give me the jet. Yeah. I now co-own an experimental Glasair too with.
Nice. I know the Glasair. Yeah. I fly SR-22 Cirrus generally, so GA, but I'm not current right now. But yeah.
It's good to have the parachute. And what's interesting, I grew up on the round dials. I used to run the Brown University Flying Club, $20 an hour wet. It's how much we pay for the gas.
Seriously.
And what's amazing now, these glass cockpits and the experimental, this has overlaps to healthcare. They give you so much information. And in the experimental world, you can just have a touchscreen. It's like a super iPad and see all the planes and the traffic and where to go. It gives you all what we call situational awareness. And that kind of ability to sift massive amounts of data just in time and give you a user interface is something that's still really lacking in healthcare. And can give us, I think, some lessons in how we translate all these new massive forms of information to actionable, useful, like fly here, take a left, take a right. Here's where the airport is. Here's where the bad weather is. And that's sort of this shift from analog to digital that we're seeing across healthcare as well.
And one of the things I'm gathering from this, which is really instructive for our audience, is that you've developed a methodology for thinking about the future of medicine. And one of your methods is to cross-pollinate. You try different experiences and sometimes pretty extreme experiences, like flying in an F-16. And then you'll gather from that some useful insight or some new perspective that you can apply to your medical practice. And that helps you think about it in a different way. Because it's true, technology is being applied at different rates in different industries. It's not always rolling out at the exact same rate. And so there's this differential there, and you can learn things if you're working with somebody who's on the very cutting edge, like the military, of course. And then you can bring that back to maybe a slow moving industry. And believe me, healthcare is a slow moving industry. It's saddled with regulations, saddled with, slow moving bureaucracies and so forth. And so it's not really, even though it's a high tech industry, it's not the most advanced tech industry. But tell me where I'm wrong about that. I want to know, how do you think about healthcare and find opportunities to deploy technologies where things can actually get done?
Yeah, just back to the COVID framing, talking about space, Sputnik sparked the space age, and hopefully COVID is sparking a bit of a new health age. And I think if we look back 10 years and to where we are now, where we're going to be in the next decade, we're going to see pretty massive transformations. Where we're sort of wrong, not wrong, but today we're now 10 years after IBM Watson, we're seeing AI really start to impact healthcare, and dozens of new AI-based applications in digital therapeutics for AI meets radiology, for example, to make everything from mammogram screenings to personal handheld ultrasounds, that you can use in the savannas of Africa with a community health worker. So we're starting to see what used to be kind of slow, these things catch up. We know Moore's law. There's also Amara's law. We overestimate what happens in 2 years and underestimate what happens in a decade. And some of these tools and technologies are really starting to catch fire, whether it's the AI piece or mRNA and sequencing and genetic engineering, all the way to this world of wearables and otherables that are really starting to give us this whole new picture of what is health, disease, and even public health and global health at scale.
Now back to COVID as a catalyst. So we had Andrew Hessel on the show, a good friend of yours, I know, and a colleague from Singularity University.
Everyone talks about Andrew when they come on this show. He's like one of the most referenced guests, right?
He's a good cross-pollinator is why. And he does exactly what Daniel was just saying, which is that he surveys across a broad landscape of technologies. His expertise is synthetic biology. And that's an industry that's often been accused of being permanent dawn, where the sun never fully rises on synthetic biology. He said, well, that's not true. He said, everybody had an experience of that. Everybody in the US, at least, and in the Northern Hemisphere during COVID-19, because that mRNA vaccine is a byproduct of synthetic biology. And so it isn't it's not being advertised that way. And candidly, probably people would resist it. They resisted the vaccine enough as it was, so it didn't need that additional headwind. But it was a way for people to get the benefit of genomic science. And then we also had Philip Alvelda on the show. And I'm not sure if you know him, but he is an AI researcher in the field of healthcare. And he made another point about COVID that I thought was quite relevant. He said, the big change from our perspective with COVID-19 is that consumers got a new expectation about diagnostics. And he said, really, for the first time in history, you can go to a grocery store or a drugstore and buy a test kit, and take it home and get a result. And it's not a result that needs to be interpreted. It's not some sort of diagnostic thing where you have to have a professional come in and read a set of values on a scale. He says, yes or no, it's black or white. It's simple. It's very clear cut. You either got it or you didn't get it. And he said, that's a new expectation in consumer healthcare. Why don't you respond a little bit to those two ideas? Because I think for most people, we missed that. In a way, it was so effective. It was presented so well, and we were so desperate for a solution that we may have missed the magic behind that and the decades of technological progress that led to the moment when you could go to a drugstore and buy a test that gave you a simple yes or no answer.
Yeah, I mean, just back to the testing. Now we're all used to having some form of home diagnostic, whether that's going to be for an infectious disease, the flu, RSV, COVID, or now picking up other elements, home hemoglobin A1Cs, and ways to track how thin your blood might be if you're on a cardiac med. And so we're certainly seeing this super convergence of where home diagnostics meets new data that hopefully then feeds into our public health system, but it might even give us that early warning that there's a hotspot. And back to the synthetic biology side, the future should be, we heard that we sequenced the early version of COVID and we're able to kind of design the vaccine within 3 days or 3 hours. That is that sort of future of N=1 medicine. We'll be able to look at your particular tumor type and generate an mRNA vaccine against your particular tumor type. That won't be a home-based diagnostic, but there are now portable, genetic sequencers that will soon pretty much, they can fit in our pocket today, but be affordable, or at least be in your clinic or drugstore. And as healthcare shifts from hospital to home or hospital to hospital or to your corner pharmacy, where you get diagnosed, the data you can integrate and how you can make that actionable is getting exciting. But we're still challenged. I actually ran an X Prize for rapid COVID testing in collaboration with Jeff Huber, the founder of Grail, and others. It was a long path to be able to get home diagnostics for COVID. Part of that was the FDA. They wanted perfect tests, the equivalent of PCR, and sometimes perfection is the enemy of the good. But I'm hopeful now with the blend of telehealth and wearables and otherables and home diagnostics, we're going to really shift the needle back to earlier diagnostics and hopefully making healthcare more equitable and democratized around the planet. Because now with a smartphone and a cheap test, you can at least self-diagnose and then get the right help at an earlier stage in a disease.
I'm glad you brought up the idea of equity, because that's going to be an important topic for us in the second half of the program, bringing health to the whole world and not just to the wealthiest people on the planet. But, what we like to do before we take our break is we like to do a lightning round of questions. This is where we ask our guests a series of short questions. My friend Brett is always the person who administers the particular poison. And so get ready for the lightning round, brought to you by Brett King.
Okay, Daniel, here's a few quick fire questions. What was the first science fiction you remember being exposed to on TV or books, movies?
Probably Star Wars is probably the most obvious one. And that blew my mind. It's always funny to go back and look at that movie now, and it feels sort of antique, and the special effects are kind of meh. But that was my first mind-blowing sci-fi. And I read Heinlein and Stranger in Strange Land, really early.
Star Wars was like one of the only movies I ever saw with my dad in a cinema, so similar. What technology do you think has most changed humanity?
Wow. Social media, maybe not for the best. I'm not sure that counts as a technology, but how we can cross-connect information. There's actually Twitter, lots of ways we used it in the pandemic and beyond. So it has, just like anything else, like AI or 3D printing, you can print a gun or print a medical device. You can have AI for good or for bad, and social media sort of in that gamish.
And maybe print a genome. We see the biohackers, right? But name a futurist or an entrepreneur that has influenced you personally.
Wow, that's a tough one. Technologists that's influenced me. I got to meet the Google guys pretty early, and I think that was influential just to see that they'd started with something pretty, at the time, basic, the search engine, and now they built this incredible ecosystem around it and went from everything from Gmail to DeepMind. And I think that, I think for entrepreneurs out there, it's good to start with a core problem, solve it, but then you have a basis to kind of amplify and do some other magical things.
Now, something a bit more related to your field. Is there any predictions or forecasts that have been made in science fiction about healthcare and the future of health that really got you thinking?
Well, I've been involved for a while with X Prize, and I helped come up with the medical tricorder X Prize, which is inspired by Star Trek, of which many things have been inspired. That idea that you can now have a home-based sensor that can wand you or touch the patient and give you the diagnosis. And we actually ran an X Prize, had some amazing teams build the equivalent of medical tricorders, which are now sort of becoming available in the pandemic and post-pandemic age. You're going to have like a TytoCare device at home, which will look in your ear and listen to your heart and lungs and be tied to your virtual visit. I think that's one example of science fiction becoming reality. And there's also, of course, 3D printing, the idea of synthesizing things. That's coming everything to printing medications, which is a project I'm working on, to printing food. And food is medicine.
Bioprinted organs too, right?
Though I don't think we're going to need printed organs, because now with CRISPR, you can humanize a pig, as you know, and transplant a humanized heart, liver, kidney. It might not be kosher, but if you're waiting for an organ, you'll take it.
Now, we can talk about transgenics maybe there in the second half, but we did get into that with Andrew Hessel a bit. But all right, great. Well, that's it for this first half of the show. You're listening to The Futurists. We'll be right back with Daniel Kraft to talk more about the future of medicine and health on The Futurist. We'll be right back. Provoke Media is proud to sponsor, produce, and support the Futurist podcast. Provoke.fm is a global podcast network and content creation company with the world's leading fintech podcast and radio show, Breaking Banks. And of course, its spin-off podcast, Breaking Banks Europe, Breaking Banks Asia Pacific, and the FinTech 5. But we also produce the official Finovate podcast, Tech on Reg, Emerge Everywhere, the podcast of the Financial Health Network, and Next Gen Banker. For information about all our podcasts, go to provoke.fm or check out Breaking Banks, the world's #1 fintech podcast and radio show.
Welcome back to The Futurists. I'm Rob Tercek with my buddy Brett King.
Hey.
And this week we are interviewing Dr. Daniel Kraft about the future. Now, Dan, thanks for making time. I know you're very busy because you got an event coming up right around the corner. Can you tell us what's up in San Diego? What are you doing?
I'm running a new event called NextMed Health. NextMed.health is the website. It's the evolution of the Exponential Medicine Conference that I founded and chaired for the last decade. And the idea around NextMed Health is that many healthcare meetings and gatherings are pretty siloed. I'm an oncologist. I'll go to oncology meetings. Cardiologists go to cardiology. There's pharma. There's medical devices. There's investor meetings. But it's rare that you mix people together, from patients and pharma and clinicians and nurses and investors and startups. And so we spend 4 days looking at this convergence of what's happening in AI, robotics, 3D printing, nanotech, genomics, blockchain, to psychedelics. People from all sorts of worlds cross-pollinating, and you sort of get the taste of the art of the possible, what's now, near, and next, and not just what's now and near, but and what's new, but sort of how do we translate some of these new technologies to clinical impact at the global scale. So it's a great place to kind of find the future, find future collaborators, and also change your mindset, because we have everyone from the head of innovation from NHS to the head of genetics at Stanford to Ron Ballas, who runs innovation in Israel, to Paul Stamets on the future psychedelics, to folks doing everything from chatbots to drones to the future of mental health and video games. So it's a great place to touch the future today and help create it going forward.
That's great.
So just if you're following that, it's nextmed.health, March 13 to 16 at Hotel del Coronado, which is a great venue for events.
And check the website, because we're probably going to be doing a free live stream of the entire element. And it's just a very rich for 4 days if you want to catch some of it. It's often, there's that famous quote, the future's already here, just not evenly distributed. And it's a great place to sort of see what's and touch what's here now and kind of get that arc. In fact, 8 years ago, we had the CEO of Moderna there, before anyone knew what mRNA was. We had the CEO of Livongo when it was 6 months old, who's now built a platform for, virtual diabetes care. A lot of folks come there and sort of get their inspiration, but also highlight what's going to be the kind of next big game changer.
It goes back to methodology. One of the ways that we love to help our audience is to talk about, what do you do in your life that helps advance the future, or bring the future to fruition. And by cross-pollinating different groups of people who are working at different aspects of the future, That's a really powerful way to accelerate progress. As you mentioned, everybody's working in a silo, and that's not limited to the healthcare or medical fields. That's true in every industry. So for the folks who are listening, this is a great lesson. What Daniel's done in his spare time, just for his own pure passion, is he's found a way to create a neutral meeting ground, a forum that connects people together who are passionate about the subject, but they might be coming at it from different angles. And that cross-pollination is where connections get made, friendships get made, attitudes get changed, perspectives change. And as a result, a little bit of future progress gets made. So that's powerful. And the second thing you're doing that I think is really important for our listeners is that you're sharing all this information publicly in a new big public database that's available to people. Tell us about digital.health.
So digital.health came to be, number one, I was lucky to get the domain digital.health. It's very memorable. And that's a bit of a new, not so new anymore, buzzword, digital health, mobile health, connected health, the fact that we can do healthcare in this new data-driven digital era. The challenge is, and I'm pretty good at keeping up with this, there used to be, a few wearables, the Fitbit, et cetera. Now there's hundreds. There's when I gave a TED talk in 2011 about the future of medicine, there's an app for that. There were 20,000 apps. Now there's 300,000 health-related apps, and now many FDA-cleared digital therapeutics, clearly evidence-based digital platforms that can help manage everything from smoking to ADHD to, cancer therapy. And so the challenge is from clinician standpoints, and I'll give a keynote to, and speak to many folks in healthcare organizations, pharma, hospital systems, physicians. They have no clue what's already out here, let alone what's coming. So at its core, digital.health is a resource where you can learn about the cutting edge of digital health, regulatory reimbursement, journals, but we also have a database of over, I think, 2,500 solutions and companies. So if you're looking for a solution around atrial fibrillation, for example, you might find the AliveCore device, the EKG that you can run off your phone. Right. You might be able to save that in your own digital formulary and prescribe that to a patient. You might find a solution around diabetes that helps reverse it with diet called Virta, for example. And it's a bit of a discovery engine and a resource starting for clinicians to kind of build their own personal digital formulary. In the future, we'll have a consumer side. Anyone can try it, digital.health. It's free. And we love feedback on how to build it better because, again, the future's here, not evenly distributed. The trick is matching the solution and eventually the payment models, and eventually the data flows. Because again, a clinician doesn't want to just prescribe a connected blood pressure cuff and be overwhelmed with blood pressure numbers. It needs to fit into the workflow and the incentives and the payment elements as well.
Well, part of this must come back into sort of where are these data models being built? How's this data being shared? Who has access to these data models for, leveraging artificial intelligence, for example? Particularly in the United States, we've had this debate about the healthcare system, being particularly inefficient right now because of the way, the oligopolies or the monopolies present there. The US pays twice for healthcare, the OECD average, for example, and often the outcomes are, not as great. We have a high number of bankruptcies in the US that are, as a result of, or at least in part, from healthcare costs, up to 2/3. And so we do have some functional issues there. So how do we break through those elements of those firewalls from a systemic perspective with the different networks and, healthcare systems and so forth? And so the progress we're seeing in the research side, if we're trying to operationalize this, aren't we really talking about breaking through a lot of those sort of proprietary and sort of network structures that are currently in place to get better efficiency?
Yeah, as you mentioned, we have the highest costs and often like the 14th or lower in the outcomes compared to other countries in the US. And there's so many systems and many things are state by state. And right. This is beyond my pay grade, but I would say it sometimes takes outside players. We're seeing obviously everyone from Amazon to Microsoft to Apple, to even Facebook get into healthcare in a variety of ways. Amazon just combined forces with medical.
Sorry, just kidding.
And so I think what's going to be interesting is sort of the outside perspectives and these huge consumer players that have our consumer data in some cases, and they are really good at delivering care. Even though Amazon Care got put on ice, we're seeing Amazon as a virtual clinic. We're seeing the ability now for everyone to be a little more empowered and not have to wait and pay out of their pocket to see a clinician, to use some of these new tools themselves. So I think we're at the cusp of starting to connect the dots in new ways, but we really do have the challenges on the regulatory side, the FDA, sometimes the F word, that has the challenge of how do you do, software as a medical device? And to their credit, the FDA has accelerated new ways of combining new technologies, whether it's AI for radiology or software as a medical device or new pathways to AI meets drug discovery. But we need the regulars and we need the reimbursement things to come along. And right now, we still have mostly fee-for-service paying for sick care, the incentives to do more transplants, biopsies, et cetera, not to pay for true health care or self-care, where we can move the needle to being proactive and optimizing not just lifespan, but health span. So I don't think it's going to happen in any one systemic world. It's going to see buckets as well as learning from NHS and other systems which aren't perfect, but have the aligned incentives to keep people healthy and not just pay for more procedures, drugs. And
that's really interesting to hear you say that, to hear an American doctor say that we can learn from other countries' healthcare systems, because so many American politicians get kind of bombastic on this topic. They always begin by saying, we have the best healthcare system in the world, which is true if you've got money. But if you don't have money, if you're not insured, it's one of the worst, right? So there's a huge variation or a huge delta there between the people who get coverage and don't. Meanwhile, there are other countries that have a different approach, which is that they believe the best way to provide healthcare is to give everybody a decent level of healthcare. The UK does that, Canada does that, and actually the majority of industrialized nations around the world provide universal healthcare. Why don't we have universal healthcare in the United States?
It's mostly probably a political issue. I think there's some huge benefits to having some base level of universal care. There's also the challenges where you can't get your hip transplant or hip replacement as fast as you might want, as happens in Canada and the NHS. But to have everybody have that base level of they're not going to go bankrupt if they have an appendicitis or a new cancer diagnosis, I think it has huge benefits. And I think we need to be smarter about democratizing healthcare and seeing where the huge disparities are. I mean, COVID was a big eye opener in terms of who got and had mortality and morbidity, let alone the long COVID implications. And so I think unless we really address this, it's going to be unsustainable. The sick care costs are going to continue to go up.
Let me talk a little bit about that, because I've actually, to prepare for this, I actually did prepare for this. I gathered some info about the trends that are shaping the healthcare environment. And so let me share those trends with you, and then you can respond to it. So the big trends, the big macro trends for the next 10 years, more patients as the global population is aging. That's true in almost every country in the world. And more information. You mentioned it earlier. Each of us can generate terabytes of data. And where do we put that? How do we collect it? How do we analyze it? More uninsured people, because the costs continue to go up. So you have increasing costs and therefore uninsured people. Of course, there's more technology, but how do we pay for it? Less pay goes to providers. So those things together seem like a pretty formidable challenge. More patients, more information, more uninsured, less pay to providers, and yet increasing costs, and then more technology.
And then practical things like nursing gap. There's a
staffing shortage.
Yeah,
that's also true. Yep, that's the next topic. You're right.
Yeah, I mean, I'm not sure where to go exactly with this, but I would say, yes, there's a huge gap between the unmet need and the solution, and we need to now be proactive about leveraging some of these technologies to address them. And sometimes that means changing the regulations and the rules. But I would argue healthcare can be addressed and the disparities be lowered. Some technology gets expensive, but almost everyone has a smartphone today. And soon that the camera on your phone today can pick up your vital signs without having to have any sort of wearable. The chatbots are getting so good, certainly with GPT-4 and beyond, where they're going to have your entire medical history there and answer questions for you proactively in the language and culture and education level that matches you. So that means, as an example, in China, a lot of folks had no access to care. They run a platform called Good Doctor out of Ping An. I think 300 million Chinese now have some basic level of digital chatbot technology tied to physical spaces when they need to get a actual checkup or drugs delivered. So that can sort of narrow the gaps at the extreme. And then we have places like, in Africa, where there's almost no infrastructure, where you can leapfrog what's happened in the U.S. A company called Elara Health is building sort of the one medical for Africa, where you can have a low-cost portable ultrasound device, an EKG, and a chatbot, and an AI, and help up-level a community health worker or primary care doctor. So I think big picture, particularly in the next few years, we can connect some of these dots, including with omics and metabolomics and sort of that Google Maps and Waze for care, so that we're not doing one-size-fits-all prevention, diagnostics, or therapy.
Yeah, I've seen this in the fintech space. I did the Exponential finance with Peter and the SU team as well for many years. But on the finance side, one of the arenas where the US has actually fallen behind, particularly in areas like mobile payments, for example, the US is at least 10 years behind China now. But part of that is because the regulation has tried to protect the incumbents because of the lobbying systems and so forth that we have. Do you see, just like we have seen with the debate on nationalized healthcare, from the next generation MedTechs and things we're talking about, is it perhaps easier to build these startups offshore, or still the US the place to come if you're trying to build a next generation MedTech company or company that fits in the service space?
I mean, I think the innovation's coming from around the world and often can leapfrog the United States, and it's not all being invented here. I think a lot of innovation here does try and go outside the US first, where there's less regulatory constraints. And again, the lobby isn't there. I mean, example, 10 years ago, there was a AI-powered anesthesia machine that was approved in the US called Sedasys, and it would do a pretty good job at conscious sedation, pretty common anesthesia, but it was killed by, of course, the anesthesia lobby, right? They didn't want to have their lunch eaten. So it's all about sometimes following the money, the incentives, or misaligned incentives, particularly in the US system, where those are unencumbered in some other spots in the world, particularly where there's huge unmet need. And it doesn't need to be the perfect wearable that has, 100% grade blood pressure and blood sugar on it. But if you have something like that and it's a $20 Chinese knockoff, that can provide some basic level of diagnostics and data for a huge proportion of the population. That's happening in India, for example. They're leapfrogging over the US. Israel, where the data comes together and helped us understand what was working and not working in the COVID pandemic. So we can definitely learn from cross-pollination and not having a failure of imagination of what's possible here in the US-centric model.
Okay, so it seems to me that your response to the big 5 trends that I shared with you about aging population and more patients and more people uninsured, and then the idea of more technology and rising costs. The way to square that circle is that in different parts of the world, different places, they're moving at different rates to adopt technology that works today, that's available at scale today to solve practical problems. What can be done today? Now, let's go a little bit into the future. Let's just tweak that a little bit and look at the future, because Brett mentioned a moment ago a really important point, which is that there's an increasing shortage of healthcare workers. And that's not all. There's also this factor of burnout. We heard about it during COVID. Now it's here, and it's a real thing. Some 60% of healthcare workers report that they feel burnout, and some 40% intend to retire or leave the field, exit the field entirely. So the research varies there. So the data is a little bit inconsistent, but the point is that a lot of people working in healthcare are fed up and exhausted and burned out. What technologies might help us supplement or maybe substitute for healthcare workers who are leaving the workforce?
Well, first, just to address the burnout issue in general, number one part of it is the technology that's in the way. We have now in this world, I used to handwrite notes when I was a medical student. By the time I was done with training, it was all electronic medical records. And those are a huge barrier to care right now and a huge burnout factor. I like to call it epic fail. I mean, they're made for billing, not really electronic medical records. They're billing records, and they're really getting in the way and cause part of the burnout challenges. Others challenges, especially in the U.S. system, is folks feeling like they're not empowered as clinicians and they're widgets in a big machine. So there's somehow we need to get the technology to help get out of the way. For example, now our voice can help us write a note. If I'm your doc and we're doing a clinical visit, it can help write the electronic medical record note for me. That can help give us more human face time. And increasingly, as technology gets better at helping make decisions and pick the right drug, the human piece, not just holding the hand, but that's going to still remain very valuable. It's not going to you can't really replace the human touch, but there is forms of digital empathy that are going to be more and more important for virtual care. So I think if we take a few steps forward, we have a shortage of nurses and other healthcare workers. Robotics is going to play a role. It already is starting to. We're seeing humanoid type robots, avatar-like elements that are going to be empowered with AGI to help, whether it's folks at home all the way to in the operating room. Robotic surgery is already here. That's going to become more and more autonomous. We're enable a surgeon in San Francisco to teleport into a surgery in a war zone. So, we're going to see a lot of new ways of extending our reach. The metaverse is sort of here. How you can collaborate and bring teams together is going to be part of that solution. And I think the advent of AI and chatbots, et cetera, will start to decrease the burden of that one-on-one stuff that has a lot of friction, that doesn't really take a lot of cognitive load today, that can be supplanted with smart technology.
One of the things I noticed is that, at least in the United States, but this is probably true in a lot of industrialized nations, we don't really have public healthcare crises. In fact, that was what was weird about the COVID-19 outbreak. It's the first time we've had a really serious infectious disease spread across the country all at once. And it caused a kind of a panic because we're, frankly, from a public health standpoint, we're out of shape. We're not used to complying with public health mandates. So that was a tough one for most Americans to contend with. But the real issues facing Americans and American healthcare are self-inflicted. And by that, I mean the number one cause of health disorder is diabetes, and then broadly bad nutrition, but also tobacco, HIV, and now increasingly environment. These are all factors that affect health in the U.S. in an adverse way. And in a sense, they're all self-inflicted. They're all lifestyle choices that we could do differently. I'm wondering if the technologies you just mentioned, things like chatbots and self-monitoring, so on, if that can help us correct some of those bad habits and lifestyle choices that lead to bad health outcomes.
Yeah, 100%. Like 80% of our cost, morbidity, mortality is not from our genetics, but from our bad behaviors, too much stress, bad sleeping, bad environments, nutrition, et cetera. And so, yes, you can have, I think this emergent future, I like to call it, generative health, is instead of getting that one little pamphlet that says eat less and exercise more, you'll have that sort of generative environment that's going to talk to you in your language. You'll build the VR environment, the music for your workouts, the coaching for your diet, nutrition, et cetera, that can really help you build your personal health coach and essentially through your entire health journey, as well as already have your genome sequence from before you're born. We've already entered this Gattaca moment, not just to be able to measure, but even manipulate the genome. So I'm hopeful that we'll be able to sort of connect those dots. Again, I'm putting my pediatrician hat on. If you do something simple, like when you have a 6-month-old baby and you start to eat solid foods and you give them whole grains, as opposed to the white Gerber, white rice, sugary stuff, it changes their gut microbiome and their epigenetics, and their downstream risk for diabetes and other diseases goes down dramatically. So simple, proactive things early in life, not subsidizing school lunches to have lots of cheese in them, being smart about tobacco, all those things, those social determinants of health and other elements are much more impactful than the CRISPR and the robotic surgery in terms of big picture impacts.
Mm-hmm. We've also seen some leaps and bounds in a couple of areas. One is the use of psychedelics, which we'll speak about in a moment, but also, sort of, I wouldn't call it biohacking, but the fasting movement, for example. You mentioned, control of diabetes with changing your, being able to sort of reset your insulin levels with fasting. And we had Aubrey de Grey on talking about the benefits of caloric reduction and fasting for longevity in the show, and what it does for, sort of cell regeneration, autophagy, and so forth. So these are sort of non-traditional areas where we're seeing significant improvements. Are there other areas like that you're excited about that sort of are coming from a bit of left field and changing the way we think about medicine?
I know Aubrey has been a great instigator to think differently about aging as a disease, and that it's, multifactorial. And I think what I'm excited about is now, we're moving from this age sometimes of the transhumanists who want to live forever and the Alcors of the world, which sort of is not my sweet spot, to think about more like extending health span. You want 120 to be the new 90. I was actually at my wife's grandmother's 104th birthday a few months ago. We're also there at 100th. She's had an incredible health span. Part of it's from her social environments, of course, genes and habits, health. What I think is interesting now is this element of not just, precision medicine, but precision wellness and health span optimization. And that's going to start with, obviously, the basic things: exercise, sleep, social connection, sense of purpose. But now we're seeing potentially things like intermittent fasting, or some drugs still unproven, like metformin. I think we're going to move to an era pretty quickly where now, folks like David Sinclair have published, at least in mice, the ability to tune up and down your epigenetics for aging. And you might have your own personalized cocktail You might have your own personalized cocktail. The Brett or the Robert or Daniel personalized longevity pill will be different based on our genomics and other risk factors. In fact, I've been building a little new startup. You can watch a TED talk about this, about 3D printing your own personalized poly pill. So imagine in the morning you wake up and just like your coffee can have a cartridge, you'll have your little cartridge that blends your dose of aspirin, statin, rapamycin, metformin, whatever it might be, that's appropriate to help prevent disease or manage it. But that would be optimized for you based on all the Internet of Things and digital twin elements that we're learning and crowdsourcing from around the world.
It was actually depicted in The Peripheral, the new Williams Gibson series that was on Amazon Prime, where they went to the pharmacy and they had compounds sent from the future for them to 3D print in the pharmacy, and that was the personalized medicine. So maybe we can use that as a discussion. We like to wrap up the show with getting really sci-fi, out there. So looking out 20 or 30 years, what do you think the world of healthcare is going to be like then?
I think in 20, 30 years, every kid that's born will already be sequenced pre-birth. That's already happening. We'll use the sort of polygenic risk scores to give you a much better guided healthcare journey. So you can be super proactive. You know your risk of diabetes or heart disease or Alzheimer's from early on in life. You'll be much more integrated with the right tools to help stave those off. We'll have the ability to have your AI clinician with you at all times and your medical history streamed from your wearables. There's definitely dystopian elements about who has this data and what it can do and who gets up-leveled and down-leveled, but we'll have a much better picture of true personalized precision health. And we'll have quantum computing that will be able to make sense of your digital biomarkers or design that N01 drug that's right for you to prevent that cancer or manage your risk for dementia and stave it off. We'll be in an era of regenerative medicine where you can regenerate organs and tissues just by turning the right genes on and off, epigenetics inside the body. Companies like Altos Labs moving in that direction. So, it's hard to predict the future, but some of these things are going to come a bit faster than we predict if we can sort of get out of the way or smartly, meld the understand the ethics, the regulatory, the reimbursement elements, and try and make it fair and equitable. And so it's not a have or have not component. But I think it's a really exciting time, particularly with multiomics, digital twin, wearables, otherables, the sort of AI clinician in your pocket, that we can start to really bring healthcare for all and bring folks from all sorts of fields, particularly for mental health, video gaming, all the way to psychedelics as ways to really be much more proactive and not wait for disease to kind of cause our crushing challenges and costs.
And it should lower the overall national healthcare costs, these combined technologies. If you've got genomics, gene therapy that is eliminating diseases from your genome, then you don't have the cost of servicing that. But that sort of breaks the big pharma model, right?
Right. That's in trials today, that you'll take an in vivo gene therapy to knock out the bad gene that causes like super high cholesterol, for example. Right. That's not a sustainable model for pharma where they want to keep giving you the statin. This will be a one-time potential proactive cure. And that has lots of implications. And that's already sort of coming here today. We can already cure diseases like sickle cell and thalassemia from my bone marrow transplant world with gene therapy. Many diseases are complex, but we'll see some proactive cures, kind of like the Minority Report. You'll cure the disease before you even know you have it.
Wow, what an inspiring vision. Daniel, it's such a great pleasure to reconnect with you. Thank you very much for joining us on The Futurists. But folks, if you're in the San Diego area in mid-March, be sure to check out nextmed.health. That's Daniel's gathering of worldwide experts on the future of medicine, the future of healthcare. And if you can't be in San Diego, then definitely check out digital.health. That's Daniel's new repository of all the information that we just described. And it really is kind of comprehensive. I know you feel like there's a lot more to do, but boy, when I went there, I could spend hours perusing that information. So that's sort of an interesting, he makes available all of his findings and all of his research for everyone. Thank you very kindly for joining us on the show.
It's been a real honor and pleasure. I'll just give you one parting thought. And some of this is on my website, danielkraftmd.net. But the idea that we all should be healthcare futurists. A lot of these solutions are out there now. You can find them on digital.health. But your doctor, your nurse, your pharmacist, your nutritionist has no clue that they're already here. You can start to use them to match and find and solve your healthcare problems. And also, the future is being built by people outside of traditional healthcare. You don't have to be a doctor, pharmacist, biotech person to see a problem and help build the app with the kid down the street, or 3D print the mock-up of the wearable or otherable. It's a real interesting time now for everybody to play a role in not just predicting the future of health and medicine, but collaboratively creating it for all of us.
We can be active stewards of our own health. We just have to get involved and get informed. Yeah, that's a really good point. I mean, ultimately, it does come down to personal responsibility and making the right choices. Well, with the resources you're providing, people can make better decisions. So I think that's really a laudable and huge achievement. So thank you for joining us and sharing that with us today. Brett, you want to wrap up for the show?
Sure. Thanks for joining us on The Futurists this week. Next week, we'll be back with more interviews. Of course, one of the ways you can help is make sure you leave us a nice review, 5-star review on iTunes, Podcast, Stitcher, wherever it is, Spotify, wherever it is you listen to the show. Tweet us out, share it with your friends and family. That's how we get new audience members. And let us know who else you'd like to appear on the show, because we love your input into that process. We've had a lot of community involvement in that, and it's really paying off for us. But whatever happens, we will return next week with another episode of The Futurists. Until then, we'll see you
in the future. Well, that's it for The Futurists this week. If you like the show, we sure hope you did. Please subscribe and share it with the people in your community. And don't forget to leave us a 5-star review. That really helps other people find the show. And you can ping us anytime on Instagram and Twitter at Futurist Podcast for the folks that you'd like to see on the show or the questions that you'd like us to ask. Thanks for joining. And as always, we'll see you in the future.